artists from across the African continent. Since today we're focusing on our females. And to join me talk about the World Menstrual Hygiene Day and practicing menstrual health and fertility, or protecting, your menstrual health and fertility, we have obstetricians and gynecology resident, Dr. Erica Ntiamwa Mensah. Hi, Dr. Erica. How are you doing?
Hi.
You look lovely, by the way. Your dress is everything. Welcome to the show. Now, I'm sure World Menstrual Hygiene Day is quite significant to you and a lot of your colleagues. But today we'll be focusing on a different side of it. Focusing on what we can do to protect our menstrual hygiene and our fertility, because sometimes some people can end up doing things that can harm their fertility in the course of trying to figure out their menstrual health. Now, starting off with period practices that put our fertility at risk. Are there even such a thing? Is there actual period practices that can put your fertility at risk?
Oh yes, there are.
Really?
Yes. And I think that with periods, the first thing we have to talk about is hygiene. That during your periods or during your menstruation, we all know how it can be.
Yes.
We all know how uncomfortable it can be. But then the first thing is preserving your hygiene. That is being very hygienic about it.
Okay.
Because although the blood is not dirty blood, when it collects, it forms a medium for organisms to multiply and all of that. So that can lead to infections. So the number one thing is to be hygienic during that time.
Okay.
Changing pads as frequently as needed, at least twice a day. But depending on your bleeding, you change it as frequently as
you need
needed.
to.
Yes, and then showering twice a day. Just general basic hygiene practices, because the blood is not dirty blood. That's one thing we want to tell people. It's not dirty blood, but once it collects and sits there for a long time, it serves as a nidus or a medium of infections. And these infections, when you don't take care of it properly, it can spread up and then cause something that you are not too much interested in. So that's one thing.
Okay.
Yeah.
Now let's get to some of the period practices that can actually harm our fertility. So what are some of these practices that people do that thinking that I'm fixing something but end up harming something else?
All right. So with period practices, we are in a very cultural society. So there are people who, during their periods, they have all sorts of things that they insert. They have all sorts of things that they use to, some people say that they are cleaning their menstrual blood. Some people use it to be fresh down there and all those kind of things. So these are things that I think they are not necessary and they do not have a very good impact.
Okay.
Because they destroy the vaginal flora. You are introducing certain caustic substances and infections into your body. And then some people also take in several things, a lot of herbal concoctions, because sometimes some women are in pain. It's unbearable, and we understand.
Yes,
but then they take in so many
feels.
things that are not good for your health generally. So these are some of the things that we want to talk about in relation to Menstrual Hygiene Month as well.
Okay, now starting from the things that people do to clean up or freshen up, what are some of these practices and how can they harm us?
All right, so people use in order to maintain their freshness, in order to take away smells, people insert all sorts of acids and all sorts of things. Okay, so boric acid is not a bad thing.
Okay.
But people insert all sorts of concoctions, preparations. You go on Instagram and people are selling things. People
Yes.
You see it on Instagram, right?
I do.
People are selling things. You go on TikTok especially. People are giving so much advice. Use this during your period. Insert this during your period. It will make the blood clean. It will do this and that for you. And I think that they are absolutely unnecessary. Okay, we haven't done proper research to know its long-term effects, but I don't think anything good comes out of it. So these are some of the things. And I know a lot of our listeners would be on Instagram, would be on social media and all that.
Because I've seen a lot, especially people keep touting boric acid as some sort of magic healing drug. What is boric acid and how does it help us?
So boric acid is an acidic component, and then gynecologically, we see that for very chronic yeast infections, there have been some studies that support the use of boric acid. But it is not something to use for everyday freshness, everyday tightening, and for infections. If you have an infection, you have a discharge that you do not like,
go to the hospital.
Doctor. Yes, they will treat it. They'll give you the adequate medication. But if you find out that you always need boric acid, you're always taking inserting boric acid for some tightness, for some freshness, then the problem that you're having, it needs proper medical attention. The medical research about boric acid is for to help in the management of chronic or long-term yeast infections. But we are using it for so many other things. I've seen on Instagram to be tight.
I saw some there's wipes that you have to every day use it. I'm like, what is going on?
These things destroy the vaginal flora. So the vagina is self-cleansing. When we say that, people misinterpret it. It doesn't mean you shouldn't take a shower, right? But what we mean is that inside, in certain things inside, and cleaning and wiping deep inside is not necessary and it's not beneficial. Just with mild soap and water, clean the vulva, clean the outside, and go your way. Your body will do the rest.
Okay.
Yeah.
So all these intimate washes do we actually really need them?
I would say that we do not. Okay. What we need is just basic showers. Twice a day, morning and evening, mild soap, cleaning. But then if you notice any change, so as women, we shouldn't be embarrassed about it. Almost every woman from time to time, you may notice some change, some discharge, a smell, something that you do not like. Instead of going to buy these washes or these things to insert, just go to the hospital, complain about it. Some tests would be run, adequate medication would be given, and you would feel like yourself again. Because you notice that once you start using these things, you're using them all the time. And it's like the moment you stop or the day you stop, you start experiencing what you didn't like again, and you go back to it. So your body has its own ways of cleansing and cleaning itself. It doesn't mean that sometimes it fails and you may not have problems. You may have problems, but you seek the appropriate help, get back to yourself, and then go on your daily life. You do not necessarily need. People have a whole counter when you go to people's bathrooms, a whole counter of morning wipe, evening wipe, morning insert, evening insert.
And then daily intimate, daily wash,
yes.
Special wash. I'm like, what is going
period
on?
Wash, nightly wash, after sex wash. It's too much. It's too much.
Now, picking on something you said earlier about the herbs and stuff, and I've seen a lot of people that have been advertising, especially on social media, on TikTok and the mediums you mentioned, of different herbs, soak it in water, drink it every morning, do it with this, do it with that, and it creates this, and then makes you more lubricated, it makes you more this, more that, more that. Where do we draw the line?
All right, so herbal medication or herbs in general, it's not a bad thing. Okay, that's what our ancestors were using, and they reproduced us and they lived long. So we wouldn't talk against herbs. But what we would say is that some of these medication are approved by the FDA, and some of them are done scientifically. So you know what exactly is inside, you know what you're taking, and for those we have no qualms about it. But then a lot of these preparations, we do not know what is in it. We do not know where it was sourced from. We do not know the chemical components. We do not know what it does. And then the people who are saying it does this, it does that, it heals you, it does that, they have just anecdotal evidence. Someone used it and said it worked for them. But there is no study to back it, to show or to prove that it actually does this and that. And sometimes we have noticed that it causes more harm than good.
It would seem, yeah.
Yes, there's a rise in people who have chronic kidney conditions.
Yes, because they're drinking all these kind of
concoctions. So what I'll say is that people need help, women need help, and women would always have these kind of conditions, the itching, the discharge, the menstrual pain. Women would always have it. And as a woman, when you have it, you shouldn't feel embarrassed. You should know that you should seek the appropriate help. And if you want to use certain herbal medication to balance or attach, there's nothing wrong with it. But know exactly what you're doing. Get it from a good source. Instagram is not your doctor. TikTok, anyone who's prescribing medication on TikTok, I don't think you should take their advice. Okay, you should go to the right mediums, and then you
trying to using it as a barrier or as a pad of some sort, and then it entered. Then she forgot all about it, and I think it festered and became a bit of an infection. Now, walk us through the kind of things people use as a makeshift pad and how it can harm us.
All right. Now, sanitary products are essential for menstruation, but we have to acknowledge the fact that we are in a third world country and not everybody can afford certain sanitary products. So they use all sorts of things. Some people use cloths. If you go into the deep remote villages, they may use certain things that you may find unheard of, okay, to be able to soak this blood and to make them comfortable. Now, some of these things may not be very hygienic and they can lead to infections. And sometimes some people, they can afford these things, but they are in situations, or as you said, a makeshift sanitary towel, insert something, forget to take it out, and also cause infections. But even with the sanitary products that we are aware of, like using the tampons, when you use a tampon and you keep it for a certain number of hours, over 12 hours, you know, the blood collects. As as I said, the blood is not dirty, but once it collects, it allows the bacteria and everything to breed. So it can lead to something called toxic shock syndrome. It's not very common over here because we do not use tampons. Most women would use pads. Yes, but these are some of the things that are very essential to talk about, especially in the very young girls. Because a young girl who has gone to school and who maybe is using some sanitary product, a tampon or something, she'll sit in class from morning till evening, forget about it, go and do everything that she's supposed to do, and later on lead to some of these effects. So that's why we are here giving education.
So how long should a tampon be in for those that do use tampons?
All right, so with a tampon, they have different sizes and the amount of blood it can collect. So when your tampon is full or you're feeling it getting full, you should change it. But then, just like how we would advise that you should change your pad twice a day to keep yourself clean and fresh, I would also advise that you should change your tampon that number of times a day. But if you're someone who bleeds a lot, as in when you feel full, you should change it.
Okay, all right. Now coming to some of the practices, or coming to the period in itself, how do you know you're not experiencing? What are some of the symptoms to know that this is not a normal period? Maybe I need to actually go get checked. Perhaps there's something different happening.
All right. Periods themselves are uncomfortable. I don't know any woman who says she loves her period. They are uncomfortable. When you see your period coming on your calendar, you start thinking,
another 4 days of torture.
So with that aside, I mean that is normal. But then if you're about to have your period or during your period, you experience immense pain. We all have cramps from time to time, but immense pain that you're not able to go about your activities of daily living. You cannot walk, you cannot go to work, all that. You should seek help. If you're bleeding a lot, some people will tell you, they bleed heavily on the first 2 days and it tapers down. But someone will tell you that they bleed so much, they wear Pampers. Someone will tell you they bleed so much, they change their diaper. They wear a diaper that they change 3 to 4 times a day. If you're bleeding that much, it is not normal. You should seek medical attention. If your periods are extending the number of days, everyone bleeds the normal, you should not bleed for more than 8 days. But if you're telling me that you bleed for 3 weeks, you should seek medical attention because your bleeding has become too prolonged, okay? And then if you also notice that your bleeding is quite irregular, so there's a cycle and there's a pattern. But if you notice that, let's say your pattern has shifted, the bleeding has become very irregular, you have your period this month, in the next 3 months you do not have a period, you know that you're not pregnant, you should seek help. It's better to seek help early. Let us investigate. If there's no problem, we let you know. If there's a problem, we cure it or we find a solution to it as early as possible. These are some of the things to note. And I would like to say that when women or when younger girls are talking about their period pain, it should not be pushed or brushed aside. Oh, we are women, we all go through this, why are you complaining? Well, I also had my period just last month, I came to work, that kind of thing. We shouldn't do that. We should understand that everyone's pain threshold is different, and someone may actually be going through a problem or a sinister issue that is manifesting that way. So the fact that you have cramps and you're able to come to work, do everything, it doesn't mean that every other person is able to carry themselves the same way.
Yeah. Now, PCOS, I feel, has become a rising symptom amongst many women. Many years ago, I don't think it was even something that people even knew. And now all of a sudden it feels as if every other woman may or may not have it. What is PCOS for those that don't know, and how do you know you have it?
All right, so PCOS it's to expand it's polycystic ovarian syndrome. Okay, so it's a gynecological condition where there's excess of the male hormone, so androgen. So it manifests in so many ways. You may have some excessive hair. When we do a scan, we may see that you have, you may have what we call a string of pearl appearance on the ultrasound. So it manifests in those ways, okay? But then to say that PCOS is now on the rise, I wouldn't agree so much. What I'll say is that people are now vocal. There's a lot of awareness about PCOS now, and then people are being diagnosed more, because at first you may have someone, they are struggling to have a child, they are going through their normal life. You may have someone with facial hair, she's going through her normal life. Someone may not have any physical features of the PCOS, but she's going through her normal life. She's having her anovulatory periods. She's having her irregular periods once in 3 months, once in 4 months. She may not talk about it. She may not go to the hospital. She may luckily have 1 or 2 children, go on with her life. But now people are more aware. People, when they see any change in their body or when they see or they experience any of these signs and symptoms, they go to the hospital. And women are being bold and vocal. They are talking about their issues. That's why I think we feel that it's on the rise. But I think it's not something there hasn't been a shift. We are just talking about it more.
Right. With PCOS, is it genetic? Do you develop it later on in life? Were you born with it? How does that work?
All right. So PCOS, well, I wouldn't say that it's genetic. There may be a familial history, okay? But then this is something that develops as you're growing. So when you are a little girl and you are born, there's no need to diagnose you of PCOS. There are no signs and symptoms that will lead to that. But as you're growing and maybe your periods become irregular, you see some facial hair, we notice that you have excess androgens, or a lot of people come in when they are struggling with their menstruation or their fertility. That's when we pick it up and see that, oh, okay, this is the diagnosis of PCOS. So that's how it usually comes about.
Okay. All right. Now, coming to healthier period practices we can all adopt on today, World Menstrual Hygiene Days. What are some of the practices that all of us can keep beyond the basic hygiene ones you've also expanded on, that we can all keep in our back pocket and use every time that time of the month comes?
All right. So now with periods, you have to understand that you're losing blood. Okay. So you have to eat well and you have to hydrate, because a lot of times we feel weak, we feel tired, you feel very drowsy and grumpy, annoyed about everything. So eat well, hydrate. It would help you at least during this time. And then do not tough it out or toughen it out when you're having pain. You know, when you have pain, you should take some mild pain medication to make it bearable, because this is a time that you're going to be having periods repeatedly for at least 20 years. So you should be able to take some mild pain medication when you're having your cramps to be able to go through the day. Another thing is also mild exercises. So studies have shown that certain exercises that exercise the anterior abdominal wall muscle, or crunches, things like that, mild exercises, moving around, aerobics, it helps with the cramping as well. So these are some of the things that you have to look at, in addition to the basic hygiene you're talking about, because the hygiene is really important. Yeah,
I love it. Well, getting into a few messages now. AJ, please keep me anonymous. I had sex 2 days after my period ended. For fear of getting pregnant, I took a post pill, but a week later, I realized my period had come again, but lasted only for 3 days. It wasn't as painful, but I was convinced it was a post pill that had caused the developing that had crushed the developing fetus after having unprotected sex. Am I correct, or should I see my gynae now?
All right. The post pill is not an abortion pill.
Okay.
It's a pill to prevent ovulation.
Okay.
All right. So if you had unprotected sex during the last days of your period and you took the post pill, it's not going to destroy the pregnancy. If you're pregnant, take the post pill. Your pregnancy is not going to end because of it. So the reason for you having that bleeding, you should see your gynae, or you can wait it out and observe and see. But then I do not believe that the post pill destroyed the pregnancy. It could be that you've had a pregnancy loss, an early pregnancy loss, but it has nothing to do with the post pill in itself.
But post pills have a way of breaking people's periods earlier.
Okay, so when it's used, so first of all, the post pill, according to studies, it doesn't alter your menstrual period. But then when you use it several times during a cycle, some studies also show that it can alter your period. But when used originally once is an emergency pill. So when it's used for emergency practices, usually it doesn't have any bearing on your period. You would have your period as normalized. So she should see her doctor, run a pregnancy test, see what exactly is going on. But the post pill hasn't caused an abortion, if that's her question.
Okay. Now, sex during periods. A lot of people seem to have this assumption that when you have it during your period, especially unprotected sex during your periods, it has a way of neutralizing everything, and you don't get pregnant when you have sex on your period. Is this something that is true?
Okay. Sex during your periods, you have a lower chance of getting pregnant.
Okay.
But it doesn't eliminate the chance. So don't be risky. You can get pregnant, but it just lowers, you have a lower chance of getting pregnant, but you can get pregnant. Yes.
Okay.
So
okay.
Play it safe.
Play it safe. And if you're just tuning in, I'm having a wonderful conversation with Dr. Erica Ntiamwa Mensah. We're talking on World Menstrual Hygiene Day, which happens to be today, and on the topic protecting your menstrual health and fertility. If you have any questions, you can quickly send it in. We have about a few more minutes to go. 0532 300 927. That's 0532 300 927. When it comes down to sanitary products, there are a lot that are touted, from the cups to the tampons to the regular sanitary pads and a host of others. The cups seem to be gaining quite a bit of traction. Are they something that you find the next big thing when it comes down to sanitary products that women may be considering?
All right. I've seen a lot about the cups too, but I think we have to look at the comfort. Some people may find it comfortable, but younger women who have never given birth or who are not sexually active may not find it as comfortable. So I think that there would always be room for pads. Although the cups are more environmentally friendly, they are reusable. So in situations of economic hardships, these are things that it can be the next big thing in that regard. But then for certain group of women, they may not find it that comfortable. So the pads would be there for them, or the tampons.
Now, with menstrual stigma and bringing it to the end, a lot of women feel very stigmatized, especially with the way society perceives you when you have a mishap on your period, where there's leakage, or you stain your outfits, or even buying pads. I think at my big age still, I still like to cover it, or I don't let anyone see that I'm buying a pad. Like, it feels as if you shouldn't let the world know that you're approaching your period, or you're close to your period, or you are in your period. How do we work it out? How do we ensure that it's comfortable? Are we ever going to get there?
I think we'll get there, but then we have to start with educating the younger ones. Well, for the older ones, it'll be very difficult to change some of their mindsets. But school education on menstrual health, menstrual hygiene, for both the boys and girls, let them know that it is normal. It is part of a woman's life, because sometimes you do not want to talk to the younger generation about these kind of things, but you should know that children as young as 8, 9, they start having their periods, they stain themselves in class, the boys laugh at them. So the next time they are having their period, they wouldn't want to go to school. So education at that level is very important. It makes them have the mindset that it is normal, okay, and there's nothing shameful about it. I think as older women too, in as much as we are teaching the younger generation, we also have to have grace with ourselves. It's an older woman who will tell you, oh, your pad is showing, hide it, and those kind of things. You have to know that it is normal, it is part of life, there is nothing disgraceful about it, and that not everybody may experience the same signs and symptoms you do. So give grace to another person.
Absolutely.
Yeah, and I think it would help.
Fantastic on that. Now, finally, nutrition during periods, you touched on that. What kinds of meals would you advise that we look at? What to eat and what not to eat, especially to trigger the cramps and to curb the cramps in our periods?
All right. So during the period, you're losing blood. So you have to eat foods that are highly nutritious, foods that can help build up your blood stores, okay? So red meats, leafy greens and vegetables, things like that. Now, things not to eat. People always talk about sugars and caffeinated drinks and all of that. Okay, so there are some studies that support it, but it's mainly anecdotal evidence, meaning that my mother told me, so I'm not doing it. So if you notice yourself and you think that helps, you can do that. Or if it doesn't help, you stay away from it. Okay, but rather you can do warm teas. You can just eat well, hydrate a lot, and then eat fruits, vegetables, meats, green leafy things, and I think you'll be fine.
I love it.
But if the pain and the cramps is excessive, no food is going to help you. Go and see a doctor.
Absolutely. Now, let me give you final words on what World Menstrual Hygiene Day signifies to you and how we can all do better on today.
All right, so Menstrual Hygiene Day, to me, I think that we are all working towards having a period-friendly world, a world that is friendly to women when they are menstruating, a world that understands that it is a normal